Thank you.
All yours.
Good morning, everyone. My name is Sandeep Prasad, and I'm the Executive Director of Action Canada for Sexual Health and Rights. As I'm sure you know, Action Canada, Care Canada, and the Canadian Association of Parliamentarians on Population and Development hosted a parliamentary event this morning in a completely filled room of 120 guests to discuss sexual and reproductive health and rights in humanitarian settings. The panel included my colleagues here with me today, Christina Weggs, Care International Global Advocacy Lead on SRHR, Onyema Afulukwe, who is the Senior Counsel for Africa with the Global Legal Program at the Center for Reproductive Rights, and Syrian activist and women's rights defender Muzna Daraid, all of whom will be able to answer any questions you have following some brief statements. We came together today to address the needs of the most marginalized women and girls in the world. Through the mandate of the Minister of International Development and La Francophonie, who provided introductory remarks this morning, Canada has identified sexual and reproductive health and rights as one of its top development priorities. Last year, the government committed $650 million for these issues and launched a feminist international assistance policy which supports initiatives that seek to address the immediate needs of women and girls affected by crises and to empower them with information and skills to survive and thrive. Few other donor countries are taking such a bold approach, and the international community is looking to Canada for leadership in this area. Collectively, we are calling on the Government of Canada to step up further as a defender of women's rights and a champion of sexual and reproductive health and rights. We are asking Canada to increase its commitment to a dedicated funding pool for humanitarian initiatives with dedicated funding for sexual and reproductive health and rights, and a robust policy for sexual and reproductive health and rights that includes a specific focus on humanitarian settings and guides the work of Global Affairs Canada. As the G7 summit approaches, we will look to Canada to hold the line on sexual and reproductive health and rights, and not shy away from difficult conversations on this topic. Canada and the rest of the G7 leaders must prioritize the sexual and reproductive health services and as life-saving interventions and the rights that these women and girls are entitled to. Thank you.
Thank you.
So, good morning. I wanted to follow up on a few comments, sharing some of our discussion this morning. There are 32 million women and girls who are affected by humanitarian crises, but consistently we're under-prioritizing their needs. And one of the areas that's most neglected is sexual and reproductive health and rights. And today we talked about the fact that these needs that are often invisibilized, that are forgotten, are critical and need to be core and fundamental to any humanitarian response. We know that, in fact, the need for sexual and reproductive health services increases during times of crisis. Women are at increased risk for unwanted pregnancies. They're at increased risk for unsafe abortion. They're at increased risk for deaths from complications of pregnancy and childbirth. And it's critical that we respond to these needs. The magnitude of the need is great. We know that in any displaced population, there will be many women who are pregnant who are in need of obstetric care, and some women who will need emergency services so that they can survive pregnancy and childbirth. We know that there are many women who have been displaced who really want to access contraceptive services so that they can wait to have a child until their life is stabilized and they know they're able to care for their child. I know from CARE's own experience, we see that one of the services that women seek when they come to our clinics is contraceptive services. That's really a priority for them. We know that sexual and gender-based violence spikes during times of crisis. It's estimated that 70% of women affected by crisis have experienced at least one form of gender-based violence, compared to 35% of women globally. And we often hide this or forget about this, but men and boys are often also victims of sexual violence. And survivors of sexual and gender-based violence need critical life-saving services to prevent transmission of HIV, to prevent unwanted pregnancy, to receive treatment for injuries, and to receive the critical psychosocial support that they need. Today, we talked about the fact that the need is enormous, that the demand is fierce, but we also provided examples. We know that it's feasible to provide these services with quality in even some of the most challenging settings. So we've talked about the need, we've talked about the fierce demand, we've talked about the feasibility, but we need to remember this is also about rights. We challenged everyone in the room today to imagine that they were a person who had been displaced because of a natural disaster or displaced because of a war. They may have lost everything they own. They may never return home. They may be separated from their family and their social networks. They don't know what their future holds. In face of all this uncertainty, imagine if this person did not have control over their own body. That's what this is fundamentally about. Every person has the right to choose whether or not to have children. Every person has the right to seek the health care they need. Every person has the right to make informed and free decisions about their bodies and their sexuality and their reproduction. And everybody has the right to survive pregnancy and childbirth. So today we were really excited to see this incredible commitment and support to including comprehensive sexual and reproductive health and rights, including access to safe abortion care, post-abortion care, obstetric care, contraceptive services as a core part of humanitarian aid. And I just want to commend the Government of Canada for your incredible leadership in keeping gender equity and sexual and reproductive rights at the forefront of your feminist foreign policy and a core part of all the humanitarian aid that you support. Thank you. And I think now we just wanted to open the panel up to any questions. Oh, sorry. So we're here with some very experienced panelists, human rights lawyers, activists from the ground. We'd be welcome to answer any questions that you have.
Hi, Christina.
Yes.
I have a question about, you said that there's a lot of women seeking contraception at your clinics. What clinics are you referring to in what countries?
We work in many different countries. CARE has sexual and reproductive health and rights programming in 35 countries, and I think 15 countries in crisis-affected settings. So we're working in Syria, we're working in Chad, we're working in the Democratic Republic of Congo, we're working in Bangladesh in the Rohingya crisis. One thing I'd also like to say is that we are working often, whenever we can, in partnership in strengthening local health services so that we're sure to invest in the local services where they're there. And we also provide a lot of the services through local partners. Also, CARE and UNFPA and other partners, one way that we provide contraceptive services to populations on the move is by offering mobile services.
And in your meetings with officials this morning, did you get any further commitments in terms of funding for sexual and reproductive health commitments?
Can I hand that over to you?
Sure. Yeah, absolutely. Apart from what was in Budget 2018 with the dedicated humanitarian pool, there were no specific commitments made this morning, but we're hopeful that the minister was in attendance the whole meeting this morning, so we're hopeful that something will come out of that.
Talk a little bit about how this government's commitments to these issues compare with the last government's.
Yeah, I mean, this has been quite a significant policy change from the Harper government to the Trudeau government. Under the Harper government, which had led the Muskoka initiative focused on maternal, newborn, and child health, those initiatives specifically excluded SRH services and other sorts of interventions such as contraception, safe abortion, adolescent-focused programming, and advocacy as well. These are gaps that the current government has identified as priorities for them, and has invested a significant amount of money to supporting those sorts of initiatives. So quite a significant policy change from the previous government to the current government.
Thank you very much. Merci beaucoup.
Merci beaucoup.
Thank you.